We are often told that therapy is a safe harbor. It is presented as a universal good, a place where anyone struggling with anything can go to find solace and understanding. The idea is simple. You talk, a trained professional listens, and slowly things begin to mend. For many people, this holds true. It is a lifeline, a vital tool for navigating the complexities of the human mind. The world is a noisy, demanding place, and having a quiet room to unpack your thoughts can be profoundly healing. We see it portrayed in films and on television as the ultimate act of self-care, a brave step towards a better, more stable future. But what if that safe harbor turns out to be a storm? What if the very act of talking, of being seen and scrutinized, does not soothe but instead ignites a deeper, more frightening chaos within? This is a reality for some, a truth that sits uncomfortably against the mainstream narrative of therapy's universal benefits. For undiagnosed autistic people, the therapeutic process can backfire. Instead of building resilience, it can dismantle it. Instead of offering clarity, it can create a fog of confusion and distress, leaving them more vulnerable than when they first walked through the door. This isn't to say that therapy is inherently flawed or that therapists are ill-intentioned. Far from it. The issue lies in a fundamental mismatch, a collision between a system designed for a neurotypical brain and a brain that operates on an entirely different wavelength. It is like trying to run software designed for one type of computer on another, with a completely different operating system. It will not just fail to work, it may corrupt the entire system. We must begin to question the one-size-fits-all approach and acknowledge that what is healing for one person can be genuinely harmful to another. True safety requires a more nuanced understanding. The assumption of safety is perhaps the most dangerous part. When we believe something is unequivocally good for us, we push through the discomfort. We tell ourselves that the pain is part of the process, that it is the work we must do to get better. An autistic person, already accustomed to feeling out of step with the world, may internalize this therapeutic distress as yet another personal failing. This misplaced trust in the process can lead them down a path of escalating harm, all while believing they are on the road to recovery. It is a cruel paradox that deserves our urgent attention. To understand why therapy might go wrong, we must first appreciate the inner world of an autistic person. It is not a world of deficiency, but one of intensity. Imagine experiencing the world with all your senses turned up to the maximum volume, all the time. The unspoken emotional currents in a room feel like a physical force, a tidal wave of information that you are forced to process all at once. This is a daily reality for many on the autism spectrum. Our brains take in far more sensory data from the environment than a neurotypical brain does. Now place this person in a traditional therapy session. The room itself can be a sensory minefield. The therapist's perfume, the ticking of a clock, the quality of the light, the expectation to maintain eye contact. All of this can be intensely overwhelming before a single word is spoken. The autistic person is already using a huge amount of mental energy just to exist in that space. They are managing a constant, invisible barrage of stimuli. This leaves very little capacity for the complex task they are there to do: explore and articulate their deepest, most painful feelings. Their system is already approaching a state of overload. When the therapist then asks an emotionally charged question, like, "How did that make you feel?" it adds another colossal layer of demand. For an autistic person, emotions are not always readily identifiable or easily put into words. The feeling itself might be a tangled, overwhelming physical sensation, a tightness in the chest, a buzzing in the limbs, a white noise in the head. Trying to untangle it, label it, and then translate it into coherent speech is an act of immense cognitive effort. It is like being asked to solve a complex mathematical equation while standing in the middle of a loud, chaotic rock concert. This leads to a critical tipping point. The combination of sensory input and emotional demand can push the autistic brain past its capacity to cope. This is not a choice or a sign of being resistant to therapy. It is a neurological event, a system crash. The brain, in an act of self-preservation, begins to shut down processes to prevent further overload. What the therapist might see as regression or dissociation is, in reality, the beginning of an internal crisis. The very environment designed to foster emotional exploration becomes the trigger for an unbearable internal storm, leaving the person feeling fragmented and overwhelmed. When an autistic person's brain becomes completely overwhelmed, it can enter a state of shutdown. A shutdown is an involuntary neurological response where the processing parts of the brain temporarily go offline. The ability to think clearly, to speak, or even to move can be significantly impaired. To the person experiencing it, it can feel as though their mind has been wiped clean, replaced by a dense, impenetrable fog. They might still be able to hear, but the words do not make sense. They are trapped inside a silent, still body. From the outside, especially to a therapist unfamiliar with autism, a shutdown can be easily misinterpreted. It can look like dissociation or stubbornness, a refusal to engage. A therapist might see the silence as passive aggression or a sign that the client is withholding information. They might push harder, asking more questions, trying to break through the silence. They believe they are encouraging the client to confront difficult feelings, but in reality, they are pouring petrol on a fire. Each new question, each expectant pause, adds more pressure to a system that is already completely overloaded, deepening and prolonging the shutdown. This misinterpretation is profoundly damaging. The autistic person, already in a state of intense internal distress, now has to contend with the therapist's anxiety. They may feel a desperate urge to explain what is happening, but find themselves physically unable to form the words. This can create a cycle of intense shame and frustration. They know they are not being difficult on purpose, but they cannot communicate this. The therapist's gentle prodding feels like an accusation, reinforcing a lifetime of being misunderstood and judged for things beyond their control. The therapeutic alliance, the very foundation of treatment, begins to crumble. Ultimately, the therapy room, intended as a space for healing, becomes another environment where the autistic person's innate way of being is pathologized. Instead of learning to understand and manage their responses, they are taught that their natural reaction to overwhelm is wrong. They might leave the session feeling worse than when they arrived, confused, exhausted, and with a renewed sense of being fundamentally broken. The silence was not a wall to be broken down. It was a distress signal that went completely unnoticed. Many forms of talk therapy are rooted in attachment theory. The core idea is that a secure, empathetic bond with the therapist can help a person heal from past relational wounds. The therapist offers a stable, caring presence, allowing the client to safely explore their feelings about connection and trust. For many, this is a powerful and transformative experience. It provides a corrective emotional experience, showing them what a healthy, supportive relationship can feel like. The therapist's warmth and attunement help the client's nervous system to regulate, calming their anxieties and building a sense of inner security. However, for an autistic person, this model can have the opposite effect. The very things that are meant to build attachment, intense emotional focus, sustained eye contact, and the expectation of verbal reciprocity can be profoundly dysregulating. The pressure to connect in a specific neurotypical way can be overwhelming. An autistic person may build trust not through shared emotional vulnerability, but through consistency, predictability, clear, direct communication, and just sitting together in a room silently while doing something else. The ambiguous, emotionally charged nature of attachment-focused therapy can feel confusing and unsafe. The therapist's attempts at warm attunement can feel like an intrusive demand for a type of connection that is unnatural and exhausting. This mismatch can lead to a state known as fawning or people-pleasing. The autistic person, desperate to get it right and to please the therapist, may begin to mask their true feelings. They might perform the emotions they think the therapist wants to see, nodding and agreeing while internally they are panicking. They are not building a secure attachment, they are building a survival strategy. This performance is incredibly draining and creates a profound sense of alienation from their own inner experience. They are not learning to trust others, but rather learning that their authentic self is unacceptable and must be hidden. The consequences of this are severe. Instead of feeling more regulated and secure, the autistic person feels more anxious and fragmented. The therapy sessions become a source of chronic stress and trauma. They might experience an increase in shutdowns or meltdowns outside of therapy as their nervous system struggles to recover from the strain of each session. They are caught in a terrible bind. The person who is supposed to be helping them is, through no fault of their own, the source of their escalating distress. The therapy is not repairing attachment wounds. It is creating new ones, reinforcing the painful belief that they are incapable of genuine connection. When the internal pressure from overwhelming therapy sessions becomes unbearable, an autistic person needs a way to release it. Their usual coping mechanisms, like stimming or seeking solitude, might just not be enough to manage the intense emotional and sensory fallout anymore. The distress generated by the therapy itself, the confusion, the shame, the sensory overload, builds up with no clear escape route. The brain, desperate for a way to regulate itself, can latch onto extreme measures. It's in this context, really, that some people begin to engage in self-harming behaviours or substance use for the first time after starting therapy. This is a critical point that is so often missed. The appearance of self-harm is usually seen as a sign that the therapy is finally getting to the real issues. A therapist might interpret it as the client bringing their deep, hidden pain to the surface, but in reality, it can be an iatrogenic effect, a problem caused by the treatment itself. The self-harm is not a symptom of the original problem they came to therapy for. It's a desperate coping mechanism to deal with the new, overwhelming pain being generated by the therapy. It's a direct response to the dysregulation and distress of a therapeutic model that simply does not fit. Physical pain can be a powerful, if destructive, way to ground a person who is drowning in intangible emotional chaos. For a brain overwhelmed by confusing signals, the sharp, clear sensation of physical pain can provide a focal point. It cuts through the fog of a shutdown or the frantic energy of a meltdown, offering a moment of stark clarity. Similarly, substances can be used to numb the unbearable intensity of it all. These are not signs of progress. They are alarms, klaxons blaring to signal that the person's coping capacity has been breached and their system is in crisis. The tragedy here is that if the therapist misreads this signal, they may double down on the very approach that is causing the harm. They might focus more intensely on the self-harm, trying to analyze its meaning, and inadvertently add more pressure and shame. This can create a devastating spiral where the therapy increases the distress. The distress leads to more self-harm, and the self-harm leads to more intense, unhelpful therapy. The client is effectively being harmed by the very process that is meant to heal them, a heartbreaking outcome for someone who reached out for help in good faith. In most therapeutic relationships, trust is built on a foundation of empathy, warmth, and unconditional positive regard. The therapist's kindness and non-judgmental attitude create a feeling of safety, encouraging the client to open up. While kindness is never a bad thing, for an autistic person, it is not sufficient for building genuine trust. The autistic brain often prioritizes different values when assessing safety. The most important of these are predictability, consistency, and honesty. A kind but unpredictable person can feel more dangerous than a blunt but consistent one. Predictability means knowing what to expect. An autistic client needs to understand the rules of the therapeutic engagement, both spoken and unspoken. This includes practical things, like sessions starting and ending exactly on time, contact between sessions, but also relational dynamics. A therapist who is consistently direct and clear in their communication is easier to trust than one who relies on subtle social cues, metaphors, or emotionally ambiguous language. Surprises, even well-intentioned ones, can be deeply unsettling. Trust is built when the client learns, over time, that the environment and the person in it will behave in a way that makes sense and does not suddenly change. Consistency is the partner of predictability. It is about the therapist's behavior remaining stable over time. If a therapist says they will send a summary of the session, they must do it every single time. If they establish a specific way of working, they must stick to it unless a change is discussed and agreed upon well in advance. For an autistic person living in a world that often feels chaotic and nonsensical, this consistency is a lifeline. It creates a stable anchor in a sea of uncertainty. It proves that the therapist's words align with their actions, which is the cornerstone of authentic trust. A therapist's reliability is more reassuring than their warmth. Honesty, particularly direct and literal honesty, is paramount. Many social interactions are layered with subtext, polite fictions, and indirect communication, all of which can be confusing and exhausting for an autistic person to decode. In therapy, this ambiguity is a barrier to trust. The client needs to know that the therapist means what they say and will say what they mean. This includes being honest about the limits of their knowledge. A therapist who can say, "I don't know much about autism, but I am willing to learn with you," is far more trustworthy than one who pretends to be an expert they are not. This radical honesty demystifies the process and puts the client on an equal footing, fostering a true partnership. A significant portion of talk therapy, particularly models like narrative therapy, revolves around telling one's life story. The goal is to construct a coherent narrative, to find meaning in past events, and to reframe experiences in a more empowering way. This process relies heavily on a specific type of memory called autobiographical memory, the ability to recall and sequence personal events into a linear, cohesive story. It assumes that we all store and retrieve our past in this narrative format, like a film we can rewind and play back at will. This is a foundational assumption of how healing through storytelling works. However, autistic memory often functions very differently. Instead of storing memories in a linear story, many autistic people have what is sometimes described as an associative memory. Their memories may be stored as a collection of intense sensory snapshots, fragmented images, strong emotions, or isolated facts. These fragments are not always organized chronologically. They might be linked by a common theme, a sensory trigger, or an emotional resonance. Asking an autistic person to start from the beginning can be a nonsensical request. There may not be a clear beginning, middle, or end to their internal record of an event. When a therapist asks an autistic client to construct a narrative, they are asking them to perform a task that may be neurologically difficult or even impossible. The client may struggle to recall events in the correct order or to link cause and effect in a way that satisfies the therapist. This can lead to immense frustration and a sense of failure. They might feel like they are being dishonest or uncooperative when, in fact, their brain simply does not catalogue information that way. The pressure to create a story that does not exist can be so stressful that it overshadows any potential therapeutic benefit. Furthermore, forcing a narrative onto a non-narrative memory system can feel invalidating at best, or can cause false memories at worst. It implicitly suggests that the autistic way of experiencing and remembering the past is wrong. The therapy becomes an exercise in trying to fit their fragmented, sensory-rich memories into a neurotypical box, often losing the vital details and emotional truth in the process. A more effective approach would be to work with the memories as they are, exploring the sensory snapshot, honouring the emotional fragment, without insisting on a linear story. The goal should be to understand the experience, not to force it into a predefined narrative structure. Every person who enters the helping professions, whether in medicine or mental health, is guided by a primary ethical principle, primum non nocere, or first, do no harm. This is the absolute baseline. It means that before we even consider how we might help someone, we must be vigilant about the ways our interventions could potentially make things worse. It is a promise to prioritize the client's safety and well-being above all else, above our theories, our preferred techniques, and our own desire to see progress. This principle demands humility and a constant critical self-awareness from the practitioner. In the context of therapy with autistic clients, upholding this principle requires an extra layer of vigilance. Because the signs of distress in an autistic person, such as shutdown, increased stimming, or masking, can be subtle or easily misinterpreted, a therapist must be actively looking for them. They cannot simply assume that if the client is not complaining, everything is fine. The therapist has an ethical responsibility to educate themselves about how autism can present, especially in adults, and to be aware that their standard methods might be causing harm. It is not the client's job to teach the therapist. It is the therapist's professional duty to be adequately informed. When a therapist notices that a client is deteriorating, becoming more anxious, starting to self-harm, or becoming more withdrawn, they must have the courage to pause and question their own approach. The first assumption should not be that the client is resistant or that the problem is deeper than we thought. The first assumption should be, is what I am doing right now contributing to this distress? This requires setting aside ego and being willing to admit that the chosen therapeutic model may be a poor fit. It means being prepared to change course completely, or even to suggest that therapy, at this time and in this form, is not the right support. This responsibility cannot be overstated. An autistic person seeking therapy is often in a position of extreme vulnerability. They are placing an immense amount of trust in the therapist's expertise and goodwill. If that trust is broken, and if the therapy causes harm, the damage can be profound and long-lasting. It can confirm their deepest fears that they are beyond help and that no one can be trusted. Therefore, the ethical burden on the therapist is enormous. They must be the client's fiercest advocate, even if it means protecting the client from the therapeutic process itself. Our culture tends to view healing as an active, outward process. We are encouraged to talk it out, face our demons, and push through the pain. We celebrate vulnerability and see openness as a sign of strength. The idea of retreating, of being quiet, or of hiding is often framed as avoidance or weakness. We believe that to get better, we must constantly engage with our trauma. But for an autistic nervous system, which is so often overwhelmed by the demands of engagement, this approach can be counterproductive and even cruel. Sometimes the most healing thing in the world is not to be seen, but to be allowed to hide. For an autistic person, safety is often found in solitude and reduced stimulation. It is in quiet, predictable spaces where they can finally unmask and allow their overloaded nervous system to recalibrate. After a lifetime of being pressured to socialize, to perform, and to be on, the greatest gift a therapist or support person can offer is the permission to stop, the permission to be silent, the permission to retreat into their own world without judgment. This is not avoidance. It is a vital and necessary form of regulation. It is how the system recharges and finds its equilibrium after being pushed past its limits. True therapeutic safety, then, might look very different for an autistic client. It might not be a deep, emotionally revealing conversation. It might be a session where very few words are spoken. It could be a therapist simply sitting quietly with a client who is in shutdown, offering a calm, non-demanding presence. It might involve finding practical ways to reduce sensory input in the client's daily life. The goal shifts from forcing expression to creating an environment of such profound safety that the person's own healing mechanisms can finally begin to function without interference. Ultimately, we must move away from the idea that there is only one path to healing. Support must be tailored to the individual's unique neurology, not the other way around. For some autistic people, the best support might not be traditional therapy at all. It might be practical help with daily tasks, access to low-demand environments, or simply being given the space and acceptance to exist authentically. Healing does not always mean opening up. Sometimes it means being given a safe place to close the door, turn down the lights, and just be. In that quiet solitude, free from pressure and expectation, a deeper, more sustainable form of recovery can finally take root.